Thank you very much for introducing me. And very good afternoon, all the dignitaries and the delegates here. And I'm going to presenting today. My topic is diabetes monitoring, and I will share the few case studies with this. So please allow me to share my presentation here. And I apologize to all of you. Please allow me to stop my video because I have a very unstable internet connection here. Thank you very much. Is it visible?
Yes, Kajal. Visible.
Okay, so before I start the diabetes monitor, all of us, we know that diabetes monitoring is a very important part in the diabetes management. But we are very sorry to see that this is a very neglected part actually in the diabetes management. Who we are, the diabetes educator who see the diabetes person in a daily basis, we have seen that when maximum cases, when they come to us, after so many months of follow-up checkup, we have seen there are so many complications has been developed. That is why the reason is because they doesn't follow up their checkups. They miss so many things because they are not in a proper monitoring. So this is a very neglected cases, and we have seen in the study, which is recently published in the ICMR India study, so that only 7% of the diabetes population in India are in control of the blood glucose, blood pressure, and the lipids. From our organization, the Diabetes Awareness in You, we regularly, approximately in every day, we do the last screening camp in our municipality corporation area, where we see the newly detected the diabetes person, and we try to assess the control of existing people who has the diabetes. In our survey, we have seen that among the 4,000 adults population within the Kolkata Municipality Corporation area also shows that 1 out of every 4 adults populations are living with diabetes. And more than that, the 80% are not in control of the blood glucose. And more than 90% are not in control of blood pressure. It is very surprisingly we have seen in our localities area. Now we can understand what is the full scenario in the whole world. So for that reason, we have started a project that is called the Diabetes Monitoring Project. Maximum of you, maybe you can't understand what has been written here in this leaflet. Actually, this leaflet for all the diabetes person who is circulated it in our localities area, it has been written here in Bengali. I will explain it in a later on. At first, I want to share with you, when we speak with all the persons who has the diabetes, what's their problem, why they can't manage well their blood glucose, why it is uncontrolled, why it has been developed so many complications. We came to know that number one problem is that why I will go every 3 month interval visit to the doctors while he prescribes the more or less same kind of medications, and he suggests me to take this kind of blood sugar. If I feel that my blood glucose is well, I feel, but they never check their blood glucose. They feel their blood glucose is well controlled, but still the doctor has prescribed them to test some blood reports, and I am actually behalf of the patients. They said that this is the wasting of money. Every 3 months interval, I am visiting the clinic. I am showing to the doctor, and they are taking my visiting charges, and more or less they are writing the same kind of medications, and all time they said to test my blood sugar. It is quite expensive for me. Another reason is that actually they feel that they doesn't have enough time to go the doctor's clinic. Maybe this is the excuses. We have seen the so many this kind of their thoughts came up to us. For that reason, we have developed this kind of project. And the other person, they says they doesn't have that much of money to continue this follow-up checkups and all. For that reason, whenever they came and the end day, they came to the clinic or doctor's chamber, after so many years, they developed so many complications. So what are included in these monitor projects? So who the persons register themselves under these projects, at first we provide them some investigation, that is a basic fasting blood glucose, postprandial along with the HbA1c. Also, after getting the reports, doctor consultation is there. Along with that, diet and lifestyle counseling has been done by the diabetes educator as well as the dietitians. And this, after that, if any persons have a complications developed or anything problem, that is the follow-up is depends on the doctors. Maybe he called them up very early, sometimes after 15 days, sometimes in a month. But generally, we in this project we provide them the every 3 months interval follow-up checkup is there, and once in a year, that is at the 12 months, we provide them all the investigations, include fasting blood glucose, postprandial, HbA1c, lipid profile, thyroid, stimulating hormone test, uric acid, urinary ACR, ECG, retinopathy test, foot care test, which includes the vascular Doppler, monofilament, that vibration and the cold hot sensation, the plantar pressure, etc. Along with that oral health checkup, that oral hygiene, it has been done by the dentist. So, give me a second, please. Thank you. Along with that, the doctor consultation also be there, as well as the dietitian and diabetes educator counseling also is there. So this is the whole monetary project. These things contains there. And we always support them in the WhatsApp. If they wants to send us the reports and etc. Once in a week, we call them from our clinic, all the teams, and to understand how the treatment procedure, how the management is going on. If anything problem is occurred, we listen carefully and try to solve this. So we try to base that their blood glucose should be in a controlled range. And we have seen that there is follow-up rate is over 90%. For that's why I will show the 2 case studies to all of you, that how it has been happened. And another things I wanted to share in this platform, that this monitor project is not very expensive. It is affordable to all the person with diabetes. Basically, in a first month, they have to register by the 1,000 rupees, and after that, every month they have to pay 500. So in a year, it cost around 6,500 bucks, and the person who has the diabetes, they should not be give the money in a huge amount in a one time, so that it is quite beneficial for the PWD. For that reason, we have started this monitor project. So this is the one real case study. I don't want it to do the name of that person. So basically, he is 30 years old, male, type 2 diabetes mellitus. He has the subcomplication, the diabetes peripheral neuropathy, which has been diagnosed by the doctor. So he is the farmer by profession. Recently, he visited our chamber with the complaint of the feeling always very thirsty, some burning and tingling sensation in his feet, and sometimes a severe headache is there. And when we talked with him, we came to know that he knows that he has diabetes somewhere. He has the doctor has been told him he has the diabetes, and he seen his blood test also. But he did not follow the doctor advice, because the village people, they have advised them, you take the Ayurvedic medicine, it can cure you, because of if you will take the allopathic medication, it have to continue till the die. And his diagnostics reports when he was at our clinic, that is in November 2022, the reports were the fasting blood glucose was 250, postprandial was 415, HbA1c is 11.7%, quite high, creatinine was the 1.1, albumin creatinine ratio was 345, and as per the clinician's advice, we have done some foot care test where the plantar pressure was quite high. And this was his clinical reports. We have done some physical examination. His BMI was 70. Basically, he was underweight. It was 110 by 70. And what we have observed that due to the high blood glucose, he was feeling a headache due to the uncontrolled blood glucose level, and the neuropathy has been developed. As the financial condition is very poor, he lives in a village, and basically no one was there who is a very good earning person. And maximum time he used to have the food which is basically from the cereals, the rice, the chapatis, and we call the puff rice, that is we call the muri in West Bengal. It's a regular food habit in his daily diet. So they doesn't ever about the like the proper meal methods. They doesn't ever the complications of the diabetes. All these things they didn't know at all. So the methods of the treatment and the care was, we have done the lifestyle modification. We try to give him the little high calorie diet plan, approximately 1800 kilocalorie, and we have given him the small frequent meals so that he doesn't feel hungry and doesn't take the large meal in at a time. And we try to properly distribute the protein, fat, carbohydrate. Along with that, we tried to choose the low cost protein sources which is easily available in his localities, so that he can at least keep some proteins in his daily diet, which it was nearly absent in his daily diet. And some pharmacological intervention. The clinician has started, he has initiated with the premix insulin 3070 twice daily, that is before breakfast and the dinner. And initially it has been started with 12 and 10 before morning and before breakfast and before dinner. But we have changed gradually the insulin doses as per the SMBG logbook. We sit with him. We try to counseling as per the in this project we kept him, and we try to counseling in every visit. We called him in every village. He doesn't his literacy level is not so high. It's very difficult to try to convince them to keep with the insulin, take the insulin, because they have so many myths about the insulin. Because of when the doctor has given him the medication, he refused it because his neighbor has advised him to take the Ayurvedic. But when he feels severely problem in his health, after that he came to us. So he has some financial constraint also. From our organization, we provide him a glucometer kit, and we try to teach him how to like maintain the SMBG logbook, how to check the blood glucose through the glucometer, etc. What is needed to manage the blood glucose level. And every week we try to call from our end so that he can under a strict monitoring. He should know that someone is there always with me. If he is feeling that today I feel some dizziness, something has happened to me, then we try to solve their problem. What was that? It was the hypoglycemia. How to manage it? So all these kind of small things we gradually try to teach him, because of for them it is very difficult to teach the insulin to cough ratio and the cough counting. It was very difficult for them, but as much as possible in their localities area, to thought about them, we try to manage the whole things. And secondly, the doctor has prescribed the tablet metformin, sustained release 500 twice daily also. So initially in a follow-up, first he follow up after 1 month, then again he continue the regular follow checkup, that is the 3 months interval. He was under this project, and we try to convince that if you will under this project, maybe you are giving the 500 is maybe it's large amount for you because of your source of income is not so much. But if you will not in under the good follow-up checkup, under not the proper monitoring, maybe one day you have some large complication will be there, and when you will go to the hospital, it's a large amount also be gone there, and along with that your health problem will be certain. So, and after 3 months interval, gradually his HbA1c level uh, uh, came to down, and as well as his weight has been gained little bit. And at first, after 3 months, it was 8.5. That recently, when he has last visited our clinic, the month of June, the HbA1c was 6.2. 6.2 is a fantastic for him. We never imagined about that. But one thing is that he dedicated, followed our suggestions, our advices. He convinced to all of them. So we feel very thankful to him that he followed us. He understand us what we're trying to told to him, and we really feel that we save a person from the complication. Till today, he is with us, and as well as we have counseling about the diabetes food care. Now he doesn't have the burning sensation in his feet, as now the blood glucose has been well controlled, and but now he is good enough with us. Now I am going to present a case study of a type 1. He is 25 years old, and he doesn't have any kind of comorbidities. He has a small business by profession. He visited the chamber first with the uncontrolled blood glucose. He has reports and already been diagnosed as type 1 diabetes mellitus in a government hospital a few years earlier, because in the government hospital that time they were getting the free insulin and the free kits from there. But after a few years, it has been stopped. And when he was feeling this kind of problem, and with some friends who are type 1 diabetes, from there he came to know, and he came to in a clinic. When he was as a 15 years old, that time he was diagnosed. He is the only earning person of the family, can't be able to purchase all the kits needed for his blood glucose management. His complaint was feeling very irritated all the time, even if he can't concentrate on his work, and some itching in his genital area. And he observed that the last few months he lost few weight. So when he came to our clinic, we done basic test we have done that time. Fasting was quite high, 350. Postprandial blood glucose was quite high, around 515, and HbA1c 10% was there. And as you can see, the albumin-creatinine ratio is also quite high. The physical examination, we have seen that the BMI is good, and blood pressure is 100/70. We have observed that due to the high blood glucose, he is feeling quite irritated all the time. And for the uncontrolled blood glucose, he has these genital area itching issues there. And we give the treatment method from being the diabetes educator and the dietitian. We give him the proper meal method, so that he can continue. He can continue the meal method, because as we can, if we give in the very strict diet plan, it is very difficult to follow in their background, because of if will give you the proper time and all, it is very difficult, because he was the only earning person. But we try to make a meal plan according to his lifestyle, so that he can continue this meal, and it can help to reduce his blood glucose level. And it's a common treatment method has been given by our consultant, initiated with the basal and bolus insulin. And when it was started by the 20-unit basal, after that we have changed the insulin doses as per the SMBG logbook. We ran a type 1 diabetes school, where we continuously educate the type 1 T1 defense regarding the food, the insulin techniques, the lipodystrophy, the hypoglycemia, SMBG, etc.
Kajal, please wrap up in 2 minutes.
Yes, sure, ma'am. And we provide in the WhatsApp support group, where they can share their blood glucose reports, and accordingly we help them to titrate their insulin doses. And we try to help this person as much as possible to manage their blood glucose. So recently, the last follow-up in the month of July, the HbA1c is 5.2, and the rest of the reports are within the normal range, and he is a regular follow-up checkup under our monitoring projects. So that's all from my end. Just I wanted to show how the monitoring can help for the person who are the diabetes. Thank you very much. We have patiently listened to me. Thank you.